be careful.
I have struggled with acne growing up and some adult acne, and it's left me with a lot of acne scars and large pores, but maybe this is the treatment that will finally fix some of my acne scarring.
Acne scarring is very, very difficult to treat. There is no treatment that acts as a virtual eraser for acne. So there's no treatment that will literally just erase those acne scars, especially the ones we call ice pick scars, away from your skin. Because of that, it is very, very difficult to treat it. There's so many treatments out there that can mildly improve acne scarring, from chemical peels to laser treatments to radiofrequency to microneedling to dermabrasion. So many things, yet none of them really works all that well.
I am visiting Blue Medi Spa to try out the Perfect Derma Peel. The treatment at the spa takes about 20 minutes and costs $295 per treatment.
Prior to watching this video, I had never heard of the Perfect Derma Peel. And my assumption is that this is a brand name peel performed by a spa out in California. Now, when I looked it up, it does appear to show that it is a TCA or trichloroacetic acid peel, which is a very common moderate depth type of chemical peel. But it also has other substances in it. It has acids like salicylic acid and phenol, but it also has other components like glutathione.
It is a chemical peel specifically for pigmentation. The glutathione, the vitamin C, the kojic acid, these things all work together to really help brighten up the skin and kind of reduce that pigmentation.
Vitamin C and kojic acid are very, very common in skincare products. And our Youn Beauty Brightening Cream, one of the major ingredients is kojic acid. So these are all great ingredients to reduce unwanted pigmentation. Glutathione is a really interesting one. This is actually an antioxidant that can be injected IV to lighten the skin overall. Some people think that Michael Jackson may have undergone glutathione injections, and these types of injections are being performed throughout Asia all the time to help lighten skin overall.
The first step is putting a prepping solution on your face, which is actually acetone, to get the skin completely clean.
Acetone is often used as a preparatory solution for chemical peels, and the idea is to degrease your skin. That allows the peels to penetrate a bit more deeply.
That's a good use of grease.
The problem with using an aggressive substance like acetone is that it really strips your skin of its normal oils. And this can make your skin feel much drier after the actual peel. For this reason, in a lot of peels that we do at my office, we do not use acetone as a preparatory treatment.
The next step is the peel. The solution is applied over the entire face with one quick pass to lay down the product.
You'll probably feel it more so.
Whoa, it is stinging. Ooh, it burns.
So that's the first pass.
Acids are used in chemical peels to create a chemical reaction with the upper layer of skin. It creates a controlled damage to that upper layer of skin, allowing that skin to eventually slough off. And this is how the anti-aging product works. Now, with pigmentation, a lot of the pigment is located in the superficial surface of the skin. So by using a chemical peel like this, it can cause that upper layer of skin to slough off, taking that pigment with it. Now, one concern I have with her undergoing this chemical peel is they've mentioned this peel is mainly meant for pigmentation. She does not have much pigmentation issues with her skin. She has more acne scarring issues, and so you're doing these types of lightening treatments for somebody who technically doesn't really need it.
This one just has no pigment.
The solution is layered on a few more times. This time, it's not as bad.
This is where you can see she has some remaining of acne scarring. So I'm gonna go ahead and really just kind of push this product into the skin to help brighten that up.
The deeper that peel goes, the more improvement she's going to get with the acne scarring. When you think about it, the acne scarring is like pits that are in the skin.
I have 5 face holes.
And by removing that upper layer of skin, those pits or those holes are more shallow, thereby improving the actual scarring. So the question is why not go really, really deep then with this peel and do tons and tons of layers? And the problem is the deeper you go, the longer the downtime and the higher the risk of scarring. And you do not want scarring after a chemical peel.
8 hours post-treatment, my face is itchy, it's red, and I have a little bit of a headache. I can't wait till the peeling starts and stops.
I do a lot of TCA peels as well as my estheticians in my office, and the one that we do most commonly is called the controlled depth peel. And it's similar to what she went through after the procedure, and you get some burning for about 15 minutes, but after that, you really don't have any pain or discomfort. And for a day or two, your skin looks pretty normal. And then things change.
On day 2, I started my post-care treatment. I washed my face in the morning with the cleanser they provided. Then I went in with the post-peel towelette. It felt very cooling on my face, but it didn't smell too delightful. After, I put on the provided moisturizer. And finally, SPF.
Each type of chemical peel has its own particular post-treatment regimen. In really light peels, like lunchtime peels, you don't really need to do anything all that special.
Oh, lunchtime!
Using a sunscreen is always important because your skin's going to be definitely more sensitive after the peel. In more moderate depth chemical peels, like the controlled depth peel that we do in my office, typically we do very similar to what she does, is you use a nice gentle cleanser, you apply a small amount of moisturizer. You don't want to have it too moisturized, as well as a sunscreen. In really deep peels, it can look like her skin has literally been burned off.
You kids don't know what face melting is.
That is a whole other situation, which is good that she didn't go through that.
As expected, on day 3, my skin started to peel around my nose and mouth. The peeling area felt very itchy, and the rest of my skin that wasn't peeling felt very tight and dry.
This is very common after a moderate depth chemical peel. That upper layer of skin has now been damaged, and it does take a couple of days for it to really react to it. You are going to be shocked at what happens next, because this is just the beginning.
Throughout day 3, the peeling got worse, but that's nothing compared to day 4.
This is day 4. It is getting out of hand.
So I carefully cut off some of the larger pieces without pulling on my skin.
Now this is absolutely perfect. It is totally fine to remove that skin that has peeled off. There's no reason for you to walk around with this peeled skin just hanging off of your face.
My skin comes off.
But what you don't want to do is you don't want to try to pull it off. Because that skin is still healing, is still going through that process of reacting to the acid, you could cause scarring if you start trying to rip it off. Not a good idea. Did you know that you can look upwards of 5 years younger in just 2 minutes a day? You don't need to put a ton of products on your skin to look and feel amazing. The Youn Beauty 2 Minutes 5 Years Younger Skincare Bundle is perfect for the busy person who wants glowing skin with the least amount of work. I put these 4 products together just for you. They're made with natural and organic ingredients, great for all skin types, and perfect for all genders. Check out the Youn Beauty 2 Minutes 5 Years Younger Skincare Bundle at younbeauty.com and get over $30 off the individual product price. I guarantee you'll love these products or your money back.
Day 5, the peeling moved up to my forehead, eyebrows, nose, and around my neck. Once I washed my face and put on moisturizer, I kind of liked the way my new skin looked. It seemed very fresh and dewy.
The length of time it takes your skin to peel is a sign of how deep your peel went and how much change you're going to get. So some people will peel for 2 or 3 days, and that's going to be more of a superficial peel. 5 to 7 days is going to be more of a moderate depth chemical peel, where the peel technically goes down to the papillary dermis, which is the superficial portion of the deep skin. 7 to 10 days of peeling is more of a deeper moderate depth chemical peel, which is usually safe. Once you get beyond 10 or 12 days of peeling, now you're in more of a deeper peel that does have a higher risk of complications, and we don't do those types of peels in my office.
After a full week, the heavy peeling had stopped, and I mostly had little flakes around my hairline, ears, and neck.
1 week of peeling is a perfect time frame when you're looking at clinical results. Once again, if you go less than that, you're not going to get as much of a change. If you go a lot more than that, then there's a risk of other types of complications like scarring and pigmentary problems. So this is a perfect time frame for a moderate depth, safe chemical peel. It's not too shallow and it's not too deep.
This thing is 100% safe.
I have a few new pimple friends joining us today right around here, but I read online that that's completely normal post-peel or post this intense facial. So it will go away. It's just my pores that are kind of like getting rid of all the gunk that's in there.
That is true. Purging is a very common thing that can happen after a chemical peel like this.
You can't purge me, man. I purge you.
And the belief is that because you're increasing the turnover of your skin, the gunk and the debris that was farther below the surface has now been pushed up to the surface, causing breakouts like this. The big thing to remember is if you do get a chemical peel and you have some breakouts like this afterwards, it is temporary, it is not unusual, stick with it, and it should resolve.
While the treatment did make my skin feel smoother and look a lot brighter, did it heal my acne scars and large pores? I would say no.
Unfortunately, there is no magic bullet for acne scarring.
Wait, what about the magic bullet?
Doing a peel like this might make it look a little bit better. Even the more aggressive treatments like a fractional laser, like dermabrasion, can improve the appearance of acne scarring maybe anywhere from 30 to 60%. But once again, there is just no eraser for these types of scars. When we do peels like this, like the controlled depth peel, I do recommend to my patients to expect at least 2 to 3 peels to get a maximal result. We find in my office that doing one peel like this may make you feel and look a little bit better, but it's that second and that third peel that can really create those changes that you're hoping to see.
Maybe if I did the treatment 5 times in a row, I'll see visible results, but the treatment is almost $300, so that's over $1,400. You have to have a lot of cash to burn, a lot of patience, and a high pain tolerance to really see some serious results.
So I don't think you need 5 treatments to really see good results, but the problem is each of these peels, you're peeling for like a week at a time. And you're talking then if you're doing 3 or 4 peels, that's 3 or 4 weeks total of downtime. And that is a lot for people.
There's got a little too much downtime.
That being said, I do believe chemical peels are pretty good bangs for your buck. They're better bangs for your buck than laser treatments that can get you a similar result because they're not that expensive as a practitioner to perform. So chemical peels are a very tried and true way to rejuvenate your skin. They've been used for a long time. But there are some new trends in cosmetic medicine that really, really work, even though they are kind of brand new. Take, for example, skin cycling. This is the hottest skincare trend on TikTok today, and this is a way that thousands of people are improving the health and the appearance of their skin. So what is skin cycling? Well, this is something you definitely need to know about, and I cover it on this video right up here. Take a peek at it. And remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.